Wellness Wednesday, and today we're talking about bicycle safety. Now, you may remember the city of West Lafayette just passed a new ordinance requiring drivers to be at least 3 feet away when passing bicyclists on the street. Traffic concerns a major point of safety for those who ride, but there are also health concerns. Physical therapist Dusti Chase from Franciscan St. Health is here this morning to talk about common bicycle injuries and how to prevent them. Good morning, Dusti.
Good morning.
Thanks for being here. First of all, let's talk about what are some most common injuries that you see from bicyclists.
We see a lot of neck and back injuries, even wrist and knee and hip injuries from riding the bike, especially long distances.
And probably to begin with, before you even get on the bicycle, there are things that you should do. And with the helmet right here, I know that's probably the #1 thing you should do is put on your helmet before you ride.
Exactly. You want to make sure that you have a well-fitting helmet. You also need to make sure that you're wearing bright clothes and that you've done some stretches before you go out on a long distance bike ride. Making sure that you have proper hydration and plenty of snacks if you're going out for a long distance as well.
You mentioned some of the injuries you see, like wrists and things like that. What's kind of the proper ways to really warm up before you get out on the road?
A lot of times I tell people even just to take a brisk walk to help warm up your muscles a little bit, and then do some stretches before you even get up on the bike. And then start slowly. Don't go out full speed, and make sure that you're gradually building up to your speed and for your distance.
Kind of like just any sport, right?
Exactly.
You want to prepare ahead of time. And having your bike adjusted for you is so important, because we were talking just before we went on the air about how that can really create some strain, especially on the back and your neck if your bike isn't adjusted for you.
Exactly. And adjustments can be as simple as going to your local bike shop and making sure that they can help set you up. If you have any specific injuries, make sure that you let them know. Or even if you're seeing a healthcare provider such as a physical therapist, they can help make adjustments so that you create less strain on your body.
Let's talk about the wrist a little bit. That's something I don't think many bicyclists may think about until afterwards, and your wrists are sore, of course. But what's kind of the proper position you should be in when you're getting ready to ride?
A neutral position for the wrist is with just a little bit of extension. And so you want to make sure that your wrists aren't hyperextended when you're biking, and that you can also pad your handlebars, as well as wearing some gloves to help protect your wrist as well.
Okay, well, let's talk a little bit about long distance cycling, because that can create a lot of strain on the body as well. What are some tips you have for those who ride for long distances?
Again, making the proper fit of the bike is the key, but then also making sure that you take your time building up your distance so your body can adjust to the longer distances. Making sure that you are not always spending time on your aero bars, which is a really hyperflex position for your back and creates a lot of strain at your neck because of the hyperextension that it can create, causing you to look up. So you need to be changing positions while you're riding as well.
Thank you so much. A lot of great tips here, and I'm sure that, if you are experiencing pain, if you're noticing pain, that's the time when you should really talk to your doctor, and maybe physical therapy an option for you.
Yes, exactly.
Okay, thanks, Dusti. Thanks for coming in.